Welcome back to the Ed Show. When it comes to health care reform, if the choice is between a bad bill or a delayed bill, I got to tell you, folks, I'll take the delay. I don't think liberals should give away the store on this one. If the bill isn't what they want, they should wait. We should wait as Americans to get it right. Now Bernie Sanders, the Senate's other independent member, is suggesting that he might filibuster the health care reform bill if it doesn't include a public option. He's showing the left isn't afraid to play hardball either. Senator Sanders joins us tonight from Capitol Hill. Senator, good to have you with us.
Good to be with you.
Are you drawing a line in the sand? Are you saying that this has to have a public option?
What I'm saying is that if the bill ends up being nothing more than hundreds of billions of dollars in subsidies for the insurance companies and the drug companies, if it's not affordable for the middle class, if we don't have a public option, widely diverse, so that people all over this country can enjoy it, then I think it's not worth proceeding. And I'm going to fight very hard to make sure that we have those aspects of the bill in there.
Okay, fight hard to get those things. I commend you for that, and so do a lot of progressives around the country, a lot of Americans who need health care across the political spectrum. But if you don't get it, you're willing to say, I'm not going to go there, and you're now really taking the position of a Joe Lieberman in a different way of doing it. What do you think?
Well, let me just say this. I'm a member of the Health Committee, and I voted for and worked on and supported what came out of that committee. If I had been on the Finance Committee, I would have voted against that bill.
Yeah.
Now, the bottom line is there is not a bill yet, but what the American people want, among many other things, is a public option all over this country, widely dispersed, so that they can choose between a private insurance company or a public plan, and that's important not only from the individual's point of view. If we're serious about cost containment, how are you going to keep private insurance rates down if there is not strong competition?
Well, you're not going to, and that's the fallacy in all of this. The House bill doesn't go far enough, in my opinion. 6 million people to the public option. Could you embrace that?
We have got to expand that very substantially. Most Americans today are of the impression that they will be given that public option, that they will have a choice between and they are going to be in for a big shock when it's just a small minority. So we're going to fight very hard to expand that as well.
And are you for this mandate? If a mandate comes out of the Senate, would you go along with that?
If, in fact, we had a strong, affordable plan that provided people with a public option, yes.
Yeah.
If not, no.
Senator, switching gears, the news out tonight, reported by CBS News, that the president's going to send 40,000 troops to Afghanistan. A quick answer on that. Do you support that?
No.
That's a quick answer. Senator Bernie Sanders, good to have you with us tonight. Thanks so much.
Good to be with you.
You bet. Earlier, I asked you, should Senate liberals filibuster the health care bill if it doesn't have a public option? 86% of you said yes, 14% of you said no. We've got a town hall meeting coming up Sunday night at the Seattle Town Hall in Seattle, Washington, and we thought all along that this health care debate was going to go to the middle of November. Well, it has. It may go, hear me now, it may go to the middle of next year. Don't give up the fight.